In car accidents, we can hurt our neck. It's a jerky movement, not totally in our control, forward, backward, sideways, etc. It can cause significant damage to the neck. So it can cause micro tears in the muscles and ligaments. The ligaments on the back can stretch out, ligaments on the corner can stretch out and develop tears. Muscles can get injured. Not just that, you can have disc issues. The discs in the neck, they can get injured also, but most important, the facet joints on the back of the spine, they can also get injured. So if you have had a whiplash injury and you have soft tissue pain that is persistent and increases as the day passes by with knots in the periscapular areas, it's classic of whiplash or posture related weakness of these muscles and wear and tear and overloading of the muscles because they can't handle the load now. So what do you do for that? Well, good posture, strengthening your body, periscapular areas really help. Electric massager can make a difference, but if you've tried these things and tried some basic injections and the steroids injection help but don't hold, you can consider regenerative medicine techniques. Usually, if you can isolate the facet joints, you can inject the facets with growth factors, stem cells, etc., and they can really make a difference for you. Other than that, if soft tissues such as muscles, right? Muscles you can only help by strengthening, but you need to be sure that there's no nerve damage at that time, because nerve damage and muscular recovery, there are different things about it. You have to be aware of some other things. So injecting the facets if they're painful, or you doing combination therapy between the facets and doing PRP, etc. for the muscles, so that the joints will heal, the muscles will heal, makes a difference. The only uncertain thing is the discs in the neck, because discs in the neck are a different kind of creature. You don't inject them commonly like you can in the lower back area. So for the cervical disc, there are issues. You can do epidural injections with steroids, and if they help, fine. If they don't, there are options for them also. But surgeons are there for a reason, that they also have skills that are only unique to them. So if someone has a bad disc that is not cooling down with steroid injections, even though we may cool down the facets and the ligaments, etc., one may have to consider surgery for that. But most of the patients tend to do very well with regenerative medicine techniques.